Hey guys, I'm Dr. Jayavrat Gupta and we are going to talk about why braces treatment is so slow. So to understand, before we know that why the braces treatment is so slow, we have to understand that the tooth is actually embedded in bone. So there is bone around the teeth. Okay, so when we are trying to move the teeth, it's not just moving freely, it is moving through the bone. So when we are trying to move the teeth, like there is a gap between the two teeth, and we are trying to close that space, the tooth has to move through this dense bone. What happens is that this part, when we apply the force, this part gets resolved or the bone gets softened, and on this part there is bone formation. So this part, the bone gets resorbed or it gets softened, and this part the bone gets hardened. So there is bone formation over here and bone resorption over here. So slowly the tooth moves over here. So this process usually takes in a month it will move by 1 millimeter. So if you have a space of 4 to 5 millimeters, it will take 4 to 5 months. So that is the reason why the tooth movement takes that much of time, and that is the reason why braces treatment is so slow. We also have to remember that after, for example, if this space is 4 millimeter, so we have closed down the space and now there is no space in between. But this bone, which is present between the two teeth, is actually still very soft. So even if we have closed down the space, we can't just remove the braces immediately. We have to keep it there for at least 2 to 3 months so that this bone gets hardened and dense bone is formed over here.